As adults age, their balance becomes more delicate due to muscle weakening, joint stiffness, and neurological changes. One of the most overlooked contributors to falls is the type of footwear older adults wear indoors. Many seniors favor comfort over support, opting for soft slippers, worn-out shoes, or even walking barefoot around the house. While this may seem harmless, these choices can severely compromise stability and increase the likelihood of slips and falls. Footwear acts as a foundation for balance. When shoes lack proper grip, arch support, or heel cushioning, they fail to stabilize the foot during movement. Slippers, especially backless ones, slide easily on smooth surfaces like tile or wood. They often lack traction and can catch on rugs or thresholds, causing the wearer to trip. Flip-flops and socks, particularly on hard floors, are also common culprits, as they provide no ankle support or friction to keep the foot grounded. Additionally, aging feet undergo structural changes such as flattening arches, reduced fat padding, and joint deformities like bunions or hammer toes. These conditions demand footwear that can accommodate the foot's needs while offering corrective support. However, many seniors continue to wear ill-fitting or outdated shoes that exacerbate pain and instability. Physicians and physical therapists strongly recommend choosing indoor footwear that mimics the security of athletic shoes. The ideal pair should have a non-slip, rubber sole, a wide toe box, adjustable closures like Velcro or laces, and a firm heel counter for added ankle support. Orthotic inserts may also help by improving alignment and relieving pressure points. For those prone to foot swelling, breathable and adjustable shoes are key. It's also important for seniors to replace shoes regularly. Worn soles lose their tread and cushioning, diminishing their protective function. A good rule of thumb is to check shoe grip and structure every 6 months, especially for frequently used pairs. Encouraging seniors to wear shoes indoors may require a mindset shift. Many view removing shoes at home as a cultural or comfort habit, but the trade-off is increased risk. A compromise could be having a dedicated indoor shoe that is both supportive and comfortable, offering the benefits of stability without the discomfort of outdoor footwear. One of the most underestimated causes of balance issues in older adults is dehydration and poor nutrition. After the age of 70, the body's ability to regulate hydration and absorb nutrients efficiently declines. Many seniors, however, are either unaware of this change or ignore its consequences, leading to weakened muscles, low energy, dizziness, and ultimately, an increased risk of falls. Dehydration in older adults is common due to a reduced sense of thirst, kidney function decline, and sometimes medications like diuretics. Even mild dehydration can lead to symptoms such as lightheadedness, confusion, fatigue, and poor coordination, all of which affects balance. When seniors don't drink enough water throughout the day, especially in warm climates or after light physical activity, they put themselves at risk of sudden drops in blood pressure, orthostatic hypotension when standing, which can cause fainting or instability. Poor nutrition is another silent factor contributing to balance loss. As appetite diminishes with age, many seniors skip meals or eat foods lacking essential vitamins and minerals. Diets low in protein can lead to muscle atrophy, reducing strength and agility. Inadequate intake of vitamin D and calcium can weaken bones and contribute to osteoporosis, increasing injury risk if a fall occurs. Low magnesium and potassium levels can cause muscle cramps or irregular heart rhythms, while vitamin B12 deficiency affects the nervous system, leading to numbness in feet and poor proprioception, the body's ability to sense its position. In many cases, seniors rely heavily on processed or easy-to-prepare meals, which are often high in sodium and sugar, but low in nutrients. These choices not only increase the risk of chronic conditions like hypertension or diabetes, but also contribute to overall physical weakness. Add to that poor hydration, and the body is ill-equipped to support daily activities without becoming fatigued or unstable. To address these issues, physicians recommend that older adults develop simple daily habits. Drink at least 6 to 8 glasses of water a day, even if not feeling thirsty. Incorporate hydrating foods like cucumbers, oranges, melons, and soups. Prioritize nutrient-dense meals, including leafy greens, lean proteins, whole grains, and fortified dairy or plant-based alternatives. Supplement with vitamin D and B12, especially if tests show deficiency or dietary intake is insufficient. Eat small, frequent meals to avoid low blood sugar, which can cause dizziness. Family members and caregivers also play a role in promoting good hydration and nutrition. Setting reminders for water intake, preparing balanced meals, or checking in daily can go a long way in helping seniors maintain energy and avoid sudden imbalances. In summary, ignoring hydration and nutritional needs is a critical mistake that many seniors make. Proper fluid and nutrient intake is foundational to maintaining muscle strength, nerve health, and equilibrium. Small dietary adjustments can dramatically improve not just balance, but overall vitality and longevity. As people age, maintaining physical strength and balance becomes increasingly important, yet many older adults stop engaging in targeted physical activity altogether. One of the most common mistakes after age 70 is neglecting daily balance and strength exercises, which directly impacts coordination, mobility, and fall prevention. This physical inactivity gradually leads to muscle weakening, sarcopenia, poor posture, slower reflexes, and a significantly higher risk of falls. The human body loses muscle mass naturally with age up to 15% per decade after 50. If left unaddressed, this decline reduces joint stability and coordination. Strengthening muscles, particularly in the legs, hips, and core, is essential for maintaining balance while walking, standing up, climbing stairs, or turning around. Without regular use, muscles become less responsive, and the body struggles to adapt to changes in position or unexpected shifts, such as tripping or slipping. Balance is also a skill that must be practiced. Just like memory or vision, it deteriorates when not exercised. Seniors who live a sedentary lifestyle, sitting for long hours, avoiding outdoor activity, or relying heavily on furniture or walkers without strengthening exercises, find their balance abilities diminishing rapidly. This makes them more vulnerable to even minor obstacles like uneven ground or sudden movements. The good news is that balance and strength training don't require a gym or complex equipment. Simple exercises done at home or in a community setting can yield major benefits. Physicians and physiotherapists often recommend standing on one leg while holding onto a chair, gradually increasing the duration. Heel-to-toe walking in a straight line to improve foot placement. Awareness. Chair squats to build leg strength and joint flexibility. Calf raises and side leg lifts to strengthen ankles, hips and thighs. Tight or yoga for slow, controlled movements that enhance both balance and coordination. For best results, older adults should perform 15 to 30 minutes of balance and strength activities daily, even if broken into shorter sessions. Walking, gardening, light stretching, and resistance band exercises can all be part of a healthy routine. It's important to note that balance issues can sometimes stem from fear, particularly fear of falling. This fear often discourages seniors from moving more, which ironically worsens their balance over time. Supportive environments, guided physical therapy, and encouragement from family can help rebuild confidence and turn exercise into a daily habit. Neglecting daily balance and strength training is like ignoring the foundation of a building. Without it, even the healthiest diet or medications won't protect against falls. In contrast, consistent physical conditioning can help older adults maintain independence, reduce injury risk, and improve their overall quality of life. In summary, daily balance and strength exercises are a non-negotiable part of aging well. Just a few minutes a day can make the difference between walking confidently or living in fear of falling. One of the most dangerous yet overlooked hazards for seniors over 70 is a cluttered and poorly lit home environment. While many older adults feel safe and familiar in their homes, they often underestimate how changes in their vision, reflexes, and mobility can make even small objects or dim lighting serious fall risks. Physicians and geriatric specialists consistently warn that the layout and lighting of a senior's living space play a crucial role in maintaining balance and preventing injury. As we age, depth perception, night vision, and contrast sensitivity decline. This makes it harder for older adults to navigate through rooms with uneven flooring, cords, rugs, or misplaced furniture, especially in low light. Even a single misplaced shoe, pet toy, or power cable can be enough to cause a trip and fall. In fact, many fall-related hospital admissions in seniors stem from preventable home accidents. Another common issue is inadequate lighting in key areas such as hallways, stairways, bathrooms, and bedrooms. Seniors may avoid turning on lights to save energy or due to habit, but this decision can have serious consequences. Shadows and poor visibility impair judgment, making it difficult to detect changes in floor surfaces or unexpected obstacles. Motion-activated nightlights or LED strips along pathways can dramatically reduce this risk. To create a safer home environment, experts recommend the following adjustments. Declutter all wall. As we age, our sensory systems, particularly vision and hearing, undergo gradual deterioration. While this may seem like a natural part of aging, skipping regular eye and ear exams is a mistake that can directly contribute to balance issues, disorientation, and a higher risk of falls after age 70. What many seniors don't realize is that both sight and hearing are deeply tied to the body's sense of spatial awareness and coordination. When these senses decline, unnoticed or untreated, the body's ability to stay balanced suffers significantly. Let's start with vision. Good vision helps you navigate your environment, detect obstacles, judge distances, and recognize sudden changes in floor surfaces or lighting. Conditions such as cataracts, glaucoma, macular degeneration, and diabetic retinopathy can reduce clarity, depth perception, and peripheral vision. Even mild vision loss can make it difficult to see steps, uneven terrain, or furniture in the way, especially in dim lighting or unfamiliar environments. Older adults may unconsciously move more slowly or hesitate when walking, all of which can disrupt natural balance and coordination. Similarly, hearing loss is strongly associated with balance impairment. The inner ear houses not only the hearing mechanism, but also the vestibular system, which plays a central role in maintaining equilibrium. When hearing declines, especially in one ear more than the other, the brain receives distorted or incomplete sensory information. This can cause unsteadiness, dizziness, and an increased likelihood of tripping or falling. In fact, studies show that even mild hearing loss triples the risk of falls in older adults. Another problem is that many seniors adapt to declining vision or hearing without realizing the full impact. They may turn up the TV, speak louder, or move more cautiously, but fail to get checked by specialists. Often, this leads to a slow but steady decline in mobility, confidence, and a heightened fear of falling, both of which reinforce physical inactivity and social withdrawal. To prevent this spiral, physicians recommend annual eye exams, including dilation and pressure checks, to detect early signs of vision disorders, regular hearing tests, especially if others complain of raised volume levels or if there's difficulty understanding conversations. In noisy settings, wearing prescribed glasses or hearing aids consistently and ensuring they are properly fitted and maintained. Avoiding outdated prescriptions, old glasses, or malfunctioning hearing aids may actually worsen spatial perception and contribute to imbalance. For seniors who resist wearing hearing aids or glasses due to stigma, comfort, or cost, it's vital to understand that these tools do far more than improve communication. They literally help prevent falls and injuries. In summary, skipping vision and hearing checks is a critical mistake that undermines two of the body's most important systems for maintaining balance. Addressing sensory deficits early, with the help of specialists, can significantly reduce fall risk, improve mobility, and restore a senior's confidence in everyday life. Prioritizing these simple checkups is an essential part of aging safely and independently. Many older adults, over 70, hesitate to use assistive devices such as canes, walkers, grab bars, or mobility aids, either out of pride, fear of appearing old, or simple unfamiliarity with how to use them properly. Unfortunately, this reluctance or improper use can lead to serious consequences, including imbalance, loss of mobility, and dangerous falls. Physicians emphasize that assistive devices are not symbols of weakness, they are tools of independence, safety, and confidence. A major mistake seniors make is avoiding assistive devices entirely, even when signs of imbalance, muscle weakness, or joint issues become evident. Some seniors would rather hold on to walls or furniture, shuffle slowly, or limit movement altogether instead of using a cane or walker. While these coping mechanisms may seem manageable, they are unstable, unsafe, and offer no real support. Relying on furniture, for example, can backfire if the object moves or fails to bear weight. Another critical mistake is using assistive devices incorrectly. This includes setting a cane or walker at the wrong height, holding it on the wrong side, or not using it consistently. A cane that is too short may cause the user to hunch over, putting strain on the back and throwing off balance, A walker used far from the body may lead to leaning or tripping. Additionally, using an inappropriate device for one's condition, for example, using a cane when a wheeled walker is needed, can create false confidence and greater risk. To avoid these pitfalls, seniors should consult with a physical therapist or mobility specialist before choosing a device. A professional assessment ensures the right fit and function. These experts also teach proper usage techniques, which include adjusting height so elbows bend slightly about 15 to 20 degrees when holding the device, using the cane on the opposite side of the weaker leg to create better stability, learning how to navigate stairs and curbs safely with assistive devices, practicing turns, sitting down, and standing up using proper balance and leverage. In addition to mobility aids, the home environment can also benefit from assistive installations like grab bars in bathrooms, non-slip mats, raised toilet seats, and bed rails. These modifications help seniors move more confidently and safely in areas where falls are most likely, especially the bathroom. Psychological resistance is another factor. Some seniors associate assistive devices with decline, not realizing they actually extend independence by making everyday tasks safer. Framing these tools as balance boosters or confidence supports can help reduce stigma. Caregivers and family members can play a crucial role by encouraging the use of appropriate devices, ensuring they are maintained, and supporting the senior in adapting gradually. In summary, failing to use assistive devices or using them incorrectly is a serious mistake that undermines safety, balance, and long-term mobility. These tools are not a sign of failure but a proactive step toward aging with dignity, safety, and freedom. Seniors who embrace assistive aids early are often more active. Independenta, common yet underestimated mistake among older adults after age 70 is rushing through everyday movements, especially when standing up, turning, or changing directions quickly. This impulsive movement, often done without awareness, can disrupt balance, cause dizziness, or trigger a fall. Physicians and geriatric experts warn that even seemingly minor motions, when done too hastily, can overwhelm an aging body that's slower to adjust and recover. As people age, several physiological changes affect balance and coordination: reduced muscle strength, slower reaction times, decreased blood pressure regulation, and less flexible joints. These changes make the body less able to cope with sudden shifts. For instance, standing up too quickly from a chair or bed can cause a sharp drop in blood pressure, orthostatic hypotension, leading to lightheadedness, visual disturbances, or even fainting. Likewise, quick turns or pivots can throw off balance if the legs aren't stable or the core muscles aren't engaged. This issue is especially dangerous because it often occurs during routine activities: answering the phone, going to the bathroom, in the middle of the night, reacting to a doorbell, or reaching for something that's falling. In these moments, older adults tend to move out of habit, forgetting that their body needs extra time to adjust. The result: a misstep, a stumble, or a full fall that can cause fractures, head injuries, or hospitalization. To counter this, seniors should adopt a conscious habit of pausing before moving. This means giving the body time to stabilize before engaging in a movement that could compromise balance. A few simple strategies include: when standing up from a chair or bed, pause at the edge, plant both feet flat on the floor, and push up slowly using hands or armrests. Take a moment to stand still before walking. When turning, take small, controlled steps instead of twisting the upper body suddenly. Avoid sharp pivots. When bending down or reaching up, hold on to a nearby support like a countertop or chair to maintain stability. During nighttime movements, ensure the path is well lit and free of obstacles. Consider using nightlights or motion sensor lighting. Another helpful technique is practicing transitional movements as part of a daily balance routine. For example, sit-to-stand exercises, slow toe turns, or mindful walking drills can reinforce body awareness and muscle control. These exercises train the brain and body to move deliberately, not reflexively. Seniors who frequently rush often do so out of habit or because they don't feel old internally. While this mindset can be positive in some ways, it must be balanced with self-awareness and caution. A single rushed moment can undo years of independence if it results in a serious injury. Many older adults over 70 struggle with balance, but few realize that underlying medical conditions, such as neuropathy, vertigo, Parkinson's disease, or inner ear disorders are often the silent culprits. One of the most dangerous mistakes seniors make is neglecting to identify or manage these root causes. Instead, they may chalk up instability to just getting older, missing the opportunity for early intervention and prevention of falls. Take peripheral neuropathy as a common example. This condition, often caused by diabetes, vitamin B12 deficiency, or certain medications, damages the nerves in the feet and legs. As a result, seniors may feel numbness, tingling, or even pain, but more critically, they lose their sense of position and touch in the feet. Without this ground feedback, walking becomes unsafe.